Welcome back. In the chapter of preventive medicine and obstetrics, pediatrics, and geriatrics, we are going to discuss about the Child Guidance Clinic. The Child Guidance Clinic was started in Chicago in 1909. What was the intention of this child guidance clinic? It was originally intended to deal with this juvenile delinquency. So, we have studied about juvenile delinquency in a previous video. Juvenile delinquency are the offenses or the crimes which are committed by a child, that is a boy or a girl, before the age of 18 years, before the completion of 18 years. If any offense is committed by these juveniles, then it is known as juvenile delinquency. It deals with the children or adolescents who are not fully adjusted to the environment. So in that juvenile delinquency, we studied that these juveniles, they are not fully adjusted to the environment. There is some deviation from the normal youthful behavior in them. So, to deal with those children and with those adolescents who are not adjusted to their environment, they started the Child Guidance Clinic. What was the objective of this clinic? It is to prevent the children from becoming neurotics and psychotics. So, we know that neurotics are those who are, emotionally. Affected, mentally affected. They will have excessive obsession, anxiety, fear, worry, phobias. And psychotics are those who are mentally, suffering with hallucinations, illusion, delusions. All of that will be found in psychotic individuals. So we saw that the objective is to prevent the children to turn into neurotics and psychotics. Now, this juvenile delinquent child, he has to be prevented from becoming a neurotic or a psychotic in the near future. Now, what is the team of the Child Guidance Clinic? The Child Guidance Clinic has a full formed team. That is, it includes the psychiatrics and clinical psychologist, educational psychologist, psychiatric social worker. So, we see that they are psychiatrics and psychiatrist, and we have psychiatric social worker, psychiatrist and psychiatric social worker. We have psychologist as well, clinical and educational psychologist, clinical psychologist, educational psychologist. All of this will help in treating the child's mental levels mentally. Okay, to make the child mentally healthy, we have the psychiatrist and psychiatric social worker, clinical psychologist, educational psychologist. Then for the health, okay, physical health, to deal with the physical health of the juvenile, we have pediatrician, neurologist, public health nurses, etc. Then we know that to health is what the person has to be physically, mentally, social well-being, right? The physical, mental, and social well-being of an individual. So to make the child completely healthy mentally, we had psychiatrists and psychiatric social workers, psychologist, educational, and clinical. Then that was mentally. Then physical, to maintain the physical health, we have pediatrician, public health nurses, and neurologist. Pediatrician, public health nurses, and neurologist. And lastly, we have to make the baby socially healthy so that his deviant behavior, socially, his deviant behavior has to be tackled out, and he has to be made capable of going back and living in the same society with others. To deal with the social aspect, we have speech therapist and occupational therapist. Also, if it is aged 16 plus delinquent, or he is 18 years delinquent, so such delinquents less than 18 years, okay, 16, 17, reaching 18, so they have to be trained, so that they have to be taught some skills so that they can carry on their occupations when they go out. So if the delinquent was into stealing, if we don't if the occupational therapist don't work on him and teach him some skills, once he goes back into the society again, there is a high chance that he can end up again into stealing. So occupational therapist and the speech therapist will help to deal with the people with, regarding their social aspect. Then moving on to the services which are provided by this child guidance clinic, they take care of the physical health of a child, and they change their physical environment. So you can see their physical environment completely change, a peaceful environment, and the activities will be conducted. So changing their physical environment. Imagine the baby was living in slums and some areas where there was, lots of violence and very bad, cruel environment. It could be prostitution or crimes going on, drugs and so on. From such environment, you have completely changed the physical environment of the kid into this peaceful and calm and quiet environment. So first thing is to deal with the physical health of a kid by practicing yogas and other exercises. Dealing with the taking care of the physical health of the child, as well as changing the physical environment. And then psychotherapy and play therapy to restore the positive feeling of the security. So you can see the play therapy. So we are directing the kid's energy as well as his thoughts and everything into generating a positive feeling of security. Now imagine a kid who was who was into drugs, or who was like 16 plus we are talking about. So those kids, we have to restore their positive feeling of security. Now they have completely lost that security, the feeling of security. So now we have to restore their positive feeling of security. And if the kid is very small, then direct them into the play therapy, psychotherapy, etc. Okay, you can see the counseling which is going on here in this picture. You can see all are directed and the counseling sessions are going on here in the child guidance clinic. You can see the board here. Okay, child guidance clinic. And also the reconstruction of parental attitude should also be looked after. So this was about the services which were provided in the child guidance clinic. It is a very short topic, yet an important one. They might ask you in your viva question or a 3-mark question in your university. So what did we understand? The child guidance clinic was started in Chicago. Okay, it was started in Chicago in the year 1909. What was the main intention of this child guidance clinic? It is to deal with this juvenile delinquency kids, and they will deal with the children or adolescents who are not adjusted to the environment. Those children who are not adjusted to the environment have to be taken care of. And then objective, to prevent the child from becoming a neurotic or a psychotic. And then the next thing was the team, the child guidance team, the teamwork. So the child guidance is a teamwork job. So the team was comprising of what? It was comprising of a psychiatrist, a clinical psychologist, educational psychologist, psychiatric social worker, etc. And then to deal with the physical health, we had public health nurses, pediatrician, and also the neurologist. Then lastly, to make them socially fit, we had a speech therapist and the occupational therapist. Lastly, this very important is the psychiatrist. In this, the psychiatrist plays a very central role, because here mental behavior, not the physically they are not challenged, more of mental behavior. Okay, because the mental health is at task, we have to deal with mental health of the kid. So the psychiatrist plays a very central role in the child guidance clinic, because he is the one who will come at arrive at a correct diagnosis, and he forms the line of treatment in the children. Okay, so this was about the child guidance clinic. I hope everything is clear. If you like the video, hit the like button and subscribe.